Good afternoon, everyone. My name is Sunyoung Jang. I am an associate professor of Hanseol University of South Korea and very glad to present you. Today, I'd like to talk you about a study on the subjectivity of medical dispute perceived by nursing students. This is contents. Introduction. With the enforcement of national health insurance in 1989, the improvement of living standards by economic development and the increase of national interest in health, the use of medical service was also rapidly increased. Despite the provision of high-quality medical service based on the overall development of medical technology and medical personnel's content efforts, the medical disputes that started to be raised from the middle of 1980s is continuously increasing. The nurses are not only taking up the biggest part in healthcare side, but also the core manpower with the most contacts with subjects. Within the limited time in the rapidly changing healthcare environment, they should provide the safe and high-quality care to subjects. In the nursing side, the subjectivity of perception when handling subjects has huge effects on their care. Thus, it is important to understand the perception of nurses and pre-service nurses. Therefore, there is no research on medical dispute targeting nursing students. Thus, as a methodology that could understand the characteristics of each type according to the subjectivity structure of human originated not from researchers' hypotheses, but from performers' perspectives. The Q-methodology, which is a research method considering the subjectivity of subjects, is a proper research method for verifying the type of nursing students' perception of medical disputes, because the nursing students' perception of medical disputes is the subjective and unique experience of subjects. Therefore, this study aimed to provide the basic data necessary for the development of differentiated education program according to the characteristic of nursing students' perception of medical dispute in each type, as pre-service nursing before entering the nursing site with medical dispute, by understanding the subjectivity structure of medical dispute in perspectives of nursing students. The objectives of this study are to provide information about nursing students' handling in the patient of medical disputes, and also to provide the basic data for presenting the strategy of education for nursing students by examining the type of subjective perception of medical disputes and the characteristic of each type, targeting nursing students with the application of Q methodology. For this, concrete objectives of this study are as follows. The nursing student's subjective perception of medical dispute is categorized. The characteristic of nursing students' perception of medical dispute in each type are analyzed and described. This is study method. After considering the literature, media data, and preceding research on medical disputes to achieve the objectives of this study finds the subjective showing the type of subjective perception of medical disputes targeting nursing students who have experienced medical dispute. To extract the comprehensive statement about the effects of industrial accident focus medical distribution on current enrolled students of nursing department, the Q-methodology was drawn through the process like consideration of domestic following relevance, literature, open-ended questionnaire, and individual in-depth interview. By drawing about 200 Q population through those processes are then in targeting the collecting literature through the consideration of domestic following relevance literature of around 100 Q population were finally extracted. After going through the procedure of reviewing and modifying the extracted Q population of this study, final 34 examples with high discrimination are selected. As the P sample, this study selected a total 14 nursing students who voluntarily agreed to participate in this study after fully explain the objective of this study to them. This slide shows Q classification process and method. 14 nursing students, the time for each participant to complete Q classification was from 35 to 50 minutes on average. Data analysis was performed via Connor-Bis program, and Q-factor analysis utilized principal components factor analysis. The mean and the standard deviation of components are analyzed utilizing FoCos.IDIC.2021 program. This is the result. In the result of analyzing the subjectivity of medical dispute using the FoCos program, there were total 3 factors which explained 48.18% of total variance, such as 24.27% for factor 1, 12.90% for factor 2, and 11.2% for factor 3. Factor 1 shown 24.27% explanatory power, so it could be regarded as a factor explaining medical dispute in the most. Among total 14 research subjects, there were 5 people in factor 1, 5 people in factor 2, and 4 people in factor 3. Those people belonging to each factor mean the group of people showing similar response to medical dispute. The type of subjectivity of medical dispute produced by this type analysis method could be suggested as follows. First type is medical personnel-centered perception type. In the characteristics of type 1, they perceive medical dispute is position of medical personnel and also regard them as medical personnel responsibility. They said that the sincerity of medical personnel would influence medical malpractice, which would be directly lead to medical dispute. Also, according to them, despite some weakness, the medical dispute have some strengths, such as decrease of medical malpractice of making medical personnel pay attention to their service and getting a consent to the provision of produce and test after providing sufficient explanation. Therefore, type 1 was named medical personnel-centered perception type. Second type is medical dispute reduction measure focused type. In this type, the characteristics of type 2, they think that the measure for reducing medical dispute gradually increasing should be considered individually and socially. They said that the installation of CCTV in operating room and the establishment of bill and institution for solving medical dispute could reduce medical dispute that would be more increase in the future. They said that the medical personnel efforts would not be good enough to solve increase of medical dispute, so there should be interest and support in the social level. Therefore, type 2 was named medical dispute reduction measure focused type. The third type is patient-centered perception type. The type 3 focused on the cause for industry cause. The subject of type 3 aimed to think and resolve cause and process of medical dispute in the position of patient. According to them, the medical malpractice could happen in the process of treating patient, and the post-treatment is important though. They thought that the medical personnel's emergency measurement and continuous observation of patient condition could prevent medical dispute, and additionally, there should be policy level supporting such as medication organization after dispute. Therefore, type 3 was named patient-centered perception type. This is discussion. In the result of this study, the type of subjectivity of medical dispute perceived by nursing students were type 1 medical personnel-centered perception type, type 2 medical dispute reduction measures focused type, and type 3 patient-centered perception type. And this study aimed to discuss the characteristics of each type. In this study, type 1 was medical personnel-centered perception type. As perceived nurses, they sought For the measures for preventing or resolving medical dispute, focusing on the position of nurse, they thought that the medical personnel should be their best not to have any medical malpractice in hospital, and the nurses should play important roles. Type 2 was medical dispute reduction measure focused type. They think that there should be the social preventive measures or management for the occurrence of medical dispute. According to them, if it is unable to have medical dispute, regardless of sale or degree, the national social policy or regulation should be nationally and clearly established to help full medical personnel and patients. They said that the victim of medical disputes would be relatively weak in Korean society, so it would be necessary to seek for measures for protecting them. Type 3 was patient-centered perception type. They think that the efforts to maintain and enhance the patient health status are important after the calling of medical malpractice or medical dispute. They also thought that raising the medical dispute in the position of practice would be their national right rather than giving burden to medical institution or medical personnel, which could contribute to reduction of medical malpractice and medical development in the future. This research on the subjectivity would be helpful for changing the perception of medical dispute in our society. Moreover, this study could be utilized as the basic data for the development of differentiated education program by presenting the subjective structure of medical dispute perceived by nursing students as perceived medical personnel, and also the characteristic of its type. However, this study targeted a single university and did not consider the factor having effect on the perception of medical disputes for selection of subject. So it is limited to generalized the result of this study. Thus, there should be follow-up research to additional verifying the type of composing the Q sample with various background. This is conclusion. This study aimed to establish the basic data necessary for presenting the changing the perception medical dispute and the approach to nurses based on the subjective data, analyzing the nursing students' subjectivity perception of medical dispute by applying the Q-methodology. In the result of this study, total 3 factors were drawn: the type of medical dispute perceived, the nursing students who are medical personnel, centered perception type, medical dispute reduction measures, focus type, and patient-centered perception type. This study provided the basic data for establishing the improvement measurement for attitude and perception of medical dispute in the future by categorizing the nursing students' subjectivity of nursing dispute, medical dispute. This study analyzed the type of perception of medical dispute targeting nursing students and then verified the characteristics of each type. So there should be effort to develop educational program consider the characteristics of each type. This study also suggests that an additional research on the analysis of type by produce the sampling, considering various factors and the quantitative research to verify various factors have effects on the care of patients subject to medical dispute. This is a reference. Thank you very much for your attention. Now I'd like to open it up for question. That's it. Thank you for your attention.